Good morning, ladies and gentlemen, and welcome to the February 4th, 2021 State Board of Education meeting. I'm Eric Davis, Chair of the Board, and I call this meeting to order. I'd like to welcome all members, advisors, staff, visitors, online listeners, and Twitter followers, and remind the audience and those listening that this body meets monthly with its official meeting typically scheduled for the first Thursday of the month. Due to COVID-19, the board's work was split over 2 days to provide time for the needed discussions from each respective committee. And today we will conclude with our two remaining committees, Educator Standards and Practice and Business Operations. I remind our visitors and online listeners that you can follow the meeting online and see all of our materials by going to SBE meetings at stateboard.ncpublicschools.gov. Board members are reminded that it's our duty to avoid conflicts of interest and the appearance of conflict of interest as we handle the work of this board. Does any member of the board know of any conflict of interest or any appearance of conflict with respect to any matters coming before us at this meeting? If so, please state them for the record. If during the course of the meeting you become aware of an actual or apparent conflict of interest, please bring the matter to the attention of the chair. It will then be your duty to abstain from participating in discussion on the matter and from voting on the matter. At this time, I call on Lieutenant Governor Robinson to lead a Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Lieutenant Governor. As we receive COVID-19 updates from our partners in the North Carolina Department of Health and Human Services today, I highlight for the board that we will include a motion to adopt revisions to the Strong Schools Toolkit to allow all districts to open with appropriate safety measures. Chief Deputy Secretary Susan Gale Perry and Dr. Tilson will highlight the reasons for the changes in the presentation today, which follows the announcement from the Governor, Secretary Cohen, Superintendent Truitt, and myself on Tuesday. As we consider the pending recommendation, remember that the science in these updates have informed our decisions and continue to do so on the current and future school operations, and that it is our desire to get every student back into school as soon as possible, as safely as possible. I now recognize Chief Deputy Secretary Gale Perry.
Good morning, Chairman Davis, and good morning, everyone. As always, it's a pleasure to be with you today, and I'm joined by my colleague, Dr. Elizabeth Tilson, our State Health Director and Chief Medical Officer. We're going to do a few things today. One is I'll talk briefly about our current trends and indicators statewide. Dr. Tilson will go into some detail about some of the newer research that really confirms a growing body of research on children and schools and the importance of the mitigation measures that we currently have in place. And then I will conclude by talking a little bit about the updates to the toolkit at the very end. So with that, I'll just jump in and get started with some of our statewide metrics. And we can go right on to the next slide that show those statewide metrics. The upshot of the slide in front of you is really just that the good news is that as a state, much like most of the United States, we are starting to see some downward trends, not only in our total number of COVID cases, but also in our percent positive and those currently hospitalized COVID-19 patients. So some positive, moving in the right direction trends generally across the state. And if we move to the next slide, I'll break that down a little bit and we can look at the age breakdown. This is very similar to slides you've seen previously. Very typically, children in that birth to 17-year-old range tend to be least likely to get COVID-19 or to have confirmed cases of COVID-19. And that is true, but they also tend to mirror the rest of the population in terms of upward and downward trajectories. Next slide, please. I think this slide gives a little bit more important detail, and I apologize that it may be small for some of you to see, but what this really shows is really the breakdown by age of child or young children and young adults. So you see the blue line there is the 18 to 24-year-olds. You see that they have had the highest rate of cases by far relative to the other groups. But I think it's also notable here that those very young children in the birth to age 10 range tend to have the lowest number of cases. And that's very consistent, as you can see, over time. Next slide, please. Okay, and now just to talk a little bit about clusters. You know, I think we've lost the content, or at least I've lost the content. I don't know, Deanna, if other folks are seeing it and it's just me that doesn't have the content.
Stand by just a moment. We'll have it back up.
Okay, great. There we go. Okay, terrific. So just talking a little bit about clusters, we do continue to see a slow but steady trickle of clusters in schools. Again, really relatively low rates of clusters in schools, you can see there. And this has been pretty consistent over time, but you can see that it is a very, very small percentage of total cases. And we have 49 current active clusters, 34 in public schools and 15 in private schools. We have, throughout the pandemic, continued to see private school clusters both be significantly generally larger. They're among our largest clusters within a school setting, and they're also over 2 times as likely to have clusters. So moving on to the next slide. And this just shows you a comparison of education clusters in childcare camps, K-12 schools, and colleges and universities. And as you can see, relatively low numbers of clusters in K-12 settings and in childcare settings. Next slide. If we could go to the next slide, please. I'm going to be turning it over at this point to Dr. Tilson to really talk about what we're continuing to learn about COVID-19 in schools, and she will walk through sort of the current research and what we're learning. The slide isn't turning on the screen that I'm looking at. Oh, there we go. So Dr. Tilson, I'm going to turn it over to you. Dr. Tilson, we're not hearing you if you're speaking.
There we go. How about that? Can you hear me now?
Yes, ma'am.
Wonderful. Okay. Well, I was just saying that I was so pleased to be with you all and so pleased about this partnership. It's a great way to start the month off every month, and we are really grateful for the partnership on this such important topic. As Chief Deputy Secretary Gail Perry said, I'm going to talk a little bit about what we're continuing to learn in the science, in the data. I think, as we've always said, month to month, this, of course, is evolving, that no one study is perfect, that we are learning every day, but making sure that you have some of the most up-to-date studies, and then look at then the kind of compilation of the studies and overall what is the body of evidence telling us as we move forward. So I wanted to give you an update on that. But the one thing I will say is what we are continuing to learn is, and from a public health person, boy, I am so thrilled to be able to to actually be able to show this, but that we are learning that the power of prevention is strong and is great. And as much as we think those 3 W's might be pretty simplistic, I will tell you they are exceedingly powerful, and we are seeing that more and more. One, this is a study from the end of last year, but really looked from a very quantifiable way what's the amount of protection that you get from these different prevention mitigation strategies. And so what this study looked at was if somebody was exposed to somebody with COVID-19, how much protection did they get from these different mitigation strategies? And remember, in our school settings, we are layering on all of these prevention strategies, as we call the prevention lasagna. So we layer them on. But if you look at that, at this one particular study, showed that an 85% decreased risk of contracting COVID with social distancing, 77% by wearing a mask, 77% by having a contact less than 15 minutes, and 67% by frequent hand washing. Those are the individuals, and when you layer them on all together, you can understand that power of prevention. I will also say that when we look at some of our data for flu and for RSV, which are very common circulating respiratory viruses, what we are seeing this year is incredibly low rates of flu and RSV, which tells us how much these preventive strategies